So good morning. I guess it's morning, afternoon, everyone. My name is Abdullah Shihipar, and I work at the People, Place, and Health Collective at the Brown University School of Public Health. And today I'll be giving the scientific update on my project OPC Info, or rather our project OPC Info, which is a website that aims to provide plain language information on overdose prevention centers that is evidence-based. And so, yeah, without further ado, we'll get started. How I'm going to structure this presentation today is I'll give a brief overview of the project through some slides, and then I'll demonstrate what we have so far on the website. So you'll get a sneak preview because the website is not live yet. It won't be live for a few months. So that's exciting. And then we can open it up to some questions. So I'm excited to share this with you all. Cool. So one of the problems that we encounter in the United States, obviously we have, as the overdose crisis continues to continue at a rapid pace, is we have overdose prevention centers proposed as an intervention, but despite them being brought up more and more in a policy context, and despite there being so much research on it, we don't really have that accessible information available to the public or policymakers or media. And so what you find is that researchers in this field often have to, when they are contacted by media or legislators, have to gather this evidence by themselves. And it really just is time consuming. It is repetitive. And so we were thinking, why not have a resource that multiple people can use, that is easy for advocates, researchers, organizers to pass on to interested parties, and provide sort of a central hub for this information to live on. And part of the problem when you don't have that is that it's really easy for opposition and misinformation to spread when that information is hard to locate. So, this is our solution. Enter opcinfo.org. opcinfo.org is a plain language, evidence-based website that will serve as a one-stop shop for information on overdose prevention centers. And that will really range the gamut. You'll have, plain language summaries and images and videos on one hand, but you'll also have access to the primary scientific journal articles, or rather like links to them, because not all of these journal articles unfortunately are open access, but we'll provide, you'll have access to certainly a database of that scientific literature if you want. So there's kind of a spectrum of access. You can have the basic information that is summarized in plain language, all the way up to having access to those scientific materials. So as I said, the website will be plain language. It'll have, our aim is to take the wealth of information from these scientific journals and summarize them, the findings that they have, to inform people about how OPCs are a health-based tool to prevent overdoses, and really communicate the impact and communities. So our goal is to have this be interactive. The website will feature a page that works visually. Our goal is to have this page be interactive. So the website is going to feature images from an OPC, obviously not when it's being used, but images of, what an OPC looks like. We will have sort of a walkthrough. There will be illustrations and comics that illustrate how an OPC works. And of course, we will use resources. We will link and use resources that have already been developed. So, for example, like press videos and videos that have been developed by these sites as well. So like I said before, this website is aimed to be a resource. And so it won't just be, here, you can link to our website and That's where you can find this information. There will be multiple modes in which people can use this as a resource. So if they want to share social media infographics, they will have the ability to download those from this website. We have a great team also of students and staff who are also working on one-pagers who would summarize OPC research based on a topic. So if you wanted to know the topic about, public safety or community impacts or impacts on overdoses themselves, we're planning one-pagers that people can use and print out and distribute, distribute free of charge, that will all live on this website. So the resources will not just be, oh, here's a website. We aim to have, physical resources and online resources that people can use themselves in daily conversation and in their efforts to push for OPCs. So again, this will be a research hub. There will be an extensive database. Our goal is to collect articles from 2010 to the present day, so 2023, so a span of 13 years. And we have students and staff and myself currently going through the literature to compile these articles as we speak. So we're looking forward to having just this extensive database, and we're quite excited to have this extensive database that people can search by topic, by journal, by author, by a keyword or title, and it'll pull up the result for them. And so there will also be like a list of seminal papers that are cited the most, that may also have plain language summaries with them, similar to the annotated bibliography that we did, which I'll mention now. So if you might have seen, we partnered with the Drug Policy Alliance to do an annotated bibliography of studies that pertain to overdose prevention centers. That is out now, and you'll see that this annotated bibliography covers a span of about 4.5 years, from 2018 to midway 2023. DPA covered the first about 2 to 4 years, and we did the last 1.5 years. And so it was a collaborative effort. And in the meantime, while this website is being developed, people can feel free to use that website as that document as a resource. So I just put the URL there. I'll put the URL in the chat later as well. But it's pphcollective.org/OPC research, and it's a Google Doc. Excuse me, and you can feel free to pass that on in your efforts. A big component that we wanted to focus on for this, for our website, is incorporating diversity and anti-racism, because we often find that overdose prevention centers are talked about, are an important health intervention for sure, but they're also an intervention that diverts people, that is an alternative to the criminal justice approach to the war on drugs that, again, punitively and punishes Black, Indigenous, and other people of color. And in our efforts to talk about the overdose crisis while presenting OPCs as a solution, we also want to emphasize that the overdose crisis, affects everyone in the United States, and affects multiple, racial and ethnic groups, in particular with disparities, happening recently with the increases in overdose deaths. So as part of that, one important priority in the future, once the website is launched, will be to translate the website into a few key languages. And 2 languages that we have identified as key priorities is to translate the website in Spanish and Mandarin, so that these communities have access to these resources in their own language. Because what we find is that when these resources, this information is not presented in these languages, this information on OPCs can spread, and efforts can be used to target these communities and spread falsehoods about OPCs, in particular when OPCs may be located in communities where these languages may be primarily spoken. So that is a big effort, a big part of our effort here. So now the exciting part is we're going to get, can everyone, okay, I think this is good, new share. Let me try to do new share. Okay, so now the exciting part is we get to show off the website, which we have been working on for the past couple months, and it's really exciting. And I'm really looking forward to having it launched. So we're going to feature 3 pages today, and I'll just go through what we've put together so far. So if you can see, this is our opcinfo.org homepage. We have just a nice little landing at the beginning where with this illustration of 2 people at a desk with various safe supplies for drug use, and it says, overdose prevention centers are places where lives are saved and changed, where people who use drugs can receive support and care, where people can feel safe. So it kind of hits you with those it kind of just explains from the get-go what OPCs are and kind of draws you in. And then as people scroll down, that's when they can get a little more information on what OPCs are. And we kind of introduce them to the concept of it. And this is thank you. This is the PPHC team a long time ago worked on this text with me and gave me helpful suggestions and plain language suggestions. So just a thank you to the PPHC team for assisting with that. And then from what are overdose prevention centers, we get into why do we need overdose prevention centers? And as people, this kind of sets up this sort of text sets up the context of the overdose crisis in general. And one of the things that we like, one of the things I'll point out right now, a cool feature of this website is we have this sort of endnote feature, which allows people to view the citations as they're reading the document or as they're reading the paragraph. They can view the citations, and as they click on it, it will take them to the bottom of the page, which has the list of citations right there. And of course, they can click on the journal article or the news article, whatever is featured. So as part of our highlight on racial equity and featuring this as a alternative to the war on drugs, we want to position OPCs again as an alternative, not only just to stopping the overdose crisis, but really as an alternative to treating drug use as sort of a punitive measure. And so we incorporated this as a sort of special section in our homepage. And then we kind of get into the impacts. We have a separate section on the impacts, a separate page, where people can read about what what impacts OPCs have on communities. And so we have really nice illustrations here, and we divided them basically into like 4 categories. And that's another separate page, which I actually loaded here. I don't have to think. And so then we have another page that explains what impacts OPCs have on the community. We have a little section on how they reduce overdose deaths. Once again, we have the citations right there. There might be some icons here in the future that that summarize these informations into basic points. They connect people into treatment is another point that is important to emphasize. They save communities money. So obviously, as we know, multiple studies have shown that they are cost-saving interventions and very cost-effective. And then, of course, they make our communities safer. They reduce litter. They don't increase drug use. There's no increase. Studies have found there aren't increases in violent crime. And then finally, they reduce infections. And so we basically took the main impacts that we found, and we divided them into subcategories. These subcategories will also have will also be linked to. So if someone wants to link to a certain category, they can provide someone with that link and it'll jump straight to this category. And once again, we'll have all the citations at the bottom so people can just jump to each citation. And then the last page I want to feature right now is just give you a preview of the literature database that we have. This is a very, Todd Hampson, our web developer, made to emphasize this is a very, very basic outline. We're still working on, developing developing this database. So for instance, the title you'll see here is truncated. That won't be the case when the actual database is in place. People will be able to read like the full title and see the sort of keywords. But the cool thing is, as you can see, is you can sort by year, you can sort alphabetically the title. And when people, let's say someone wants to search for, I don't know, a certain paper, let's say, if I type drug checking, that paper comes up. If I type fentanyl, that paper comes up. Safe, like anything that mentions safe in the title comes up. So that will be a really useful tool for people to be able to view papers on overdose prevention centers. And as you can see, you can basically select how many entries you want to display in this table. And there will be sort of like page options to go one by one. The cool thing is also you can download this data, because certainly like we don't want people to feel like that this data is, you know, inaccessible, or we want to open it up to be in as many formats as people find useful. So there'll be the ability to put it in Excel, to put it in a CSV file, to copy it, to print it, because certainly we want people to have access to this information. And so we're really excited about developing this database. Once again, this database won't be presented in a vacuum. There will be one-pagers that summarize this information. There will be summaries of certain seminal studies, and there will be you know, additional resources like videos and infographics and stuff. So these are just like the 3 preliminary pages that we've developed, but they kind of set the scene for the rest of the website, and the rest of the pieces and components will also be developed shortly. So just going back to the slides. Give me 1 second. Okay, so everyone, I think, can see. I just wanted to put a little short note on the logo of the website we developed, and I wanted to point out certain elements of the logo that we developed for this website, just because I think it's kind of meaningful and cool. So we have a little triangle in the bottom right corner, and that emphasizes like the physical structure of an OPC. It's meant to kind of look like the roof of a house, because you know, OPCs are welcoming places. They're almost like they can be welcoming places and can feel like homes to some people. I mean, certainly we know from places in Canada that people have found that, you know, OPCs are just like places where they feel, you know, comfortable and safe. And certainly we all feel comfortable and safe in our homes, or we aim to. And so the chimney of the home is actually the hand. If you look really carefully, it's actually the hand from the Statue of Liberty that's holding a torch. And we chose this iconography specifically because the Statue of Liberty is, you know, in the United States, is used to represent like a safe haven for the marginalized, and it's also used in specifically in the context of immigration, but it's also used to emphasize people's rights and freedoms, that like the rights and freedoms people are supposed to have in the US through their emphasis on liberty. It's also, you know, the Statue of Liberty is technically commemorates like the abolition of slavery and stuff like that. So we found it was, you know, incorporating this as sort of like a beacon of like hope and liberty, and like a safe haven was something that we wanted to incorporate. And finally, you'll see that the torch is surrounded by an eye, the circle, which also doubles as sort of the icon for an information, for the icon for information. So that represents like the information aspect of the project, that this will be a place, that this website will be a place where people can get information on this topic. Cool. So that almost brings me to the end of the presentation. And so I have a bunch of appreciations that I want to share. First of all, thank you to Dr. Brendan Marshall and the rest of the PPHDEC team. There are so many people to list. We are a big team for their support, because there's certainly been a lot of feedback, a lot of assistance in just heralding this project forward. So I'm very grateful to the PPHC team and Dr. Marshall for their support. Esther Moon, she is the illustrator who designed these wonderful illustrations that we have here. And without that, like the illustrations really make the website come to life. And so I'm so appreciative for her efforts. And I've just included her website there if you want to check out her portfolio in case you have the projects you'd like to do. Todd Hampson is our web developer extraordinaire. He has provided critical support and assistance in building this website, and truly nothing would be working without his assistance. So thank you to Todd for that. Tiara Torton is a health equity scholar at the School of Public Health, and she has been instrumental in developing the literature database. In fact, so one of the first projects she worked on was the annotated bibliography, which has been a key stepping stone into developing this database. And so I'm so grateful for her assistance and her efforts on this project as well. And of course, to the Health Equity Scholar team at Brown. Finally, obviously, to the COBRE for opioids and overdose for their funding and support, which was, essential for getting this project off the ground and to getting it out there. So I'm very grateful to the COBRE for their support. And also a special thank you to the CAB, including Haley McKee and Michelle McKenzie, for their efforts in helping us get critical feedback from the community on this website. So I'll put on my PBS voice for this. So of course, we have funding for this project is made possible by the grant from the COBRE, which once again I'm very grateful for. And so that's my contact information right there. If you have any more questions about the project itself, you can email me or you can visit our website or check out our Twitter and Instagram. Thank you. And I will take any questions if you have them. Thank you so much for listening to me. And I'm looking forward to sharing the final product with you all soon.
Well, that was great. That was a great talk and exciting. When is it going to be online?
The goal of right now we have a date for January 2024. So in the early.
And what's the holdup? Is just you want to make sure it's ready, or?
Yeah. So we are currently there's just like a sheer amount of literature that is being collected at the moment, and there are also we're waiting to work with OnPoint and other specifically on the visual aspects. We want to work with OnPoint specifically on developing certain materials and making those visual aspects more compelling. And so that's what we're spending the fall doing.
The OnPoint may be gone by January 2024 if the U.S. attorney gets his way. I guess I would do it in conjunction with them, of course. But I'm guessing you're going to try and launch it as a get a little news splash with it, and have some accompanying op-eds and make some key points about it as a kind of a launch. But I'm feeling like we are under threat right now of having OPCs set back another 5 years in the US. So I think the more we can hammer it home, make these key points in the news, the better. Definitely. So even if, something like, this website's being developed, I don't know. I think just the more we can get it in the news, the better, I think, just because I'm worried about that U.S. attorneys. And I think we probably should have, a small army of people ready to drop op-eds. And um, over the website or any other topical issue that comes out, because I think we're, that's kind of all we have with this at this point is public pressure
Absolutely.
to mess with that U.S. attorney's idea. This is kind of, I haven't heard anything since the original news reports, but
Yeah, absolutely. Yeah, we are
now,
working.
yeah, go ahead.
Yeah, we are working on it as fast as we can, and we're eager to get out there as soon as we can.
Great. Now, who's the main target audience for this? Or I'm sure you have a bunch of them, but
Right. So there are a number of target audiences here. And like I said, there's sort of a spectrum. So this website is designed for people to just get information for themselves if they're a lay user. It's also designed to be a resource for people who have more information and want to get this information to key key stakeholders. So this is for instance, if you're meeting with a legislator, you can get that, and you need like one page that summarizes that information. We'll have that information there. Often what we find is what researchers have told us is when they get media requests, they have to pass these like people often, journalists often want like research studies, and so it takes time for researchers to kind of compile that for them, and so it's another way for them to get things to journalists. So certainly journalists are another key target here. So it's a number of people. It's both people who want to find information and are curious themselves, and it's also to be used for research and conversations by people who are talking about OPCs to key stakeholders.
So it's primarily an advocacy tool, not so much. I think if we can open the logjam and get get the feds to say, okay, this is a valid tool for overdose prevention and connecting people to drug treatment and other services, then it'll be valuable to like people wanting to set one up. How do you set one up? That would be another thing. And then it would also be valuable to like people who want to use one, like where, what are the rules? How do they work?
Definitely.
But right now we're not ready for either of those because
something we have talked about in the future is having a map of OPCs, hopefully when there are more than one open in the United States,
right.
having a map of like certain policies that might be in place in certain by state, having like an image resource library, because people have stigmatizing images of OPCs when they use them.
Yeah.
So these are all things that we have certainly considered in the pipeline as well.
Yeah. No, that's great. I think it really should be a very valuable tool to a lot of people. I wouldn't now. It might be worth polling some people, doing some, I don't know, focus groups or even just individual, like get some members of the press or advocates or legislators, policymakers, any other, concerned citizens to kind of look through it and, do those simple cartoons kind of turn people off, or are they exciting? Would they be, more? And you mentioned that you said, of course, you wouldn't want to show one where people are actually using, but I think that, that's not such a terrible image.
Yeah.
It could make it terrible, but I wouldn't, I just, the last one I visited was the place in New York, and it was just walking through there. I mean, I didn't have to see people using drugs, but just you get the sense talking to people, like even short video clips of what's going on there and what, like, I was completely sold. I mean, in fact, every OPC I've been to, which is I think 3 or 4 at this point, they're just great places. They're people trying to help and people getting help, and and it's a very different vibe than is portrayed in the media or than people would assume.
Definitely.
Cool. Well, so think about an earlier launch. To just, it wouldn't have to have, you don't need to complete the the literature review. In fact, you already have the earlier literature review, and it's not like you're going to complete it and then be done. You're going to continually add to it. So
Definitely, definitely.
it's sort of arbitrary when you decide to launch it. And I think, I would be cognizant of the news cycle and, maybe get ready to launch it and hit it as soon as
For sure.
something you could hook onto maybe. Or
Definitely, definitely.
great. Okay. I don't need to hog all the questions. Anybody else have questions or thoughts?
Have you done any testing on like accessibility of the site for like screen readers? I was thinking specifically like those mouse over like citations might be a little bit difficult to implement for screen readers.
For sure. Yeah, something we're thinking about. We've done testing for different, interfaces like mobile and tablet and stuff. But we haven't done screen readers. Certainly certainly for the color schemes, we've been using the sort of contrast tool as well, but that's certainly and obviously alt text for images, but that's certainly something to keep in mind. My hope is that even if the hover, my hope is that the hovers don't necessarily interfere with it. Like if the hovers don't pick it up, thankfully it's still in plain text format at the bottom. So that would hopefully help. But yeah, thank you for raising that.
Yeah, sorry, I don't want to like nitpick. That's just
No,
something
no worries. No, I
interested
appreciate
in with
it.
web development.
I appreciate it.
Can you tell me what screen readers are?
They're for blind people. It like reads out loud the text on a page so that blind people can navigate the page.
All right.